So we treat a lot of diabetic patients, and one of the most significant reasons for vision loss in a diabetic eye is diabetic macular edema. And the other big complication in diabetic eyes is cataract surgery and cataract progression over time. And so the way we learn as clinicians how to manage these two together is what we did in the PROMISE study. The PROMISE study was undertaken to determine how we manage diabetic macular edema, which occurs sometimes after cataract surgery in these patients, and how best to educate our colleagues on how best to manage these sort of complications. The purpose of the study was really to evaluate the use of an anti-VEGF agent in the time of cataract surgery versus patients who received a sham injection to determine if they had a better clinical outcome, both from vision and OCT and other parameters we looked at. And the study basically found a significant number of patients developed macular edema following surgery in the sham arm. About 50% of patients developed macular edema if you lose a couple different criteria definitions for that. And in those patients in the aflibercept arm, then the rates were much, much lower in the 10 to 14% range. Now, if you look at that a little bit differently, as far as macular edema goes by thickness of the OCT, that number drops to about 30% in the sham arm to only about 1% in the aflibercept treated group patients in that study. So we did see anatomical benefits. Probably the one that I think is the most important benefit of this study was those patients who were 20/20 following surgery. And in those groups, a significantly higher percentage of patients in the aflibercept arm were 20/20 better following surgery versus those in the sham treated groups. And when we talk about cataract surgery patients, we always want to achieve that 20/20 outcome, and this drug definitely helped achieve that in the phase 2 study. The phase 3 will be important to power that study to show the differential both in visual acuity and anatomy following the cataract surgery. And again, it could lead to an approval of this drug in a fashion for patients to prevent macular edema following cataract surgery, and those at the highest risk of that condition, which is those patients who have diabetic retinopathy at baseline.